We appreciate it. We appreciate Dr. Pauli here. We love being on and just giving our resources out to the community to help. I met Dr. Pauli at such a great time. I'm an ordinary, just normal mom at home, and she came at the perfect time because you're that mom running around with a toddler. My husband's opening a business. You know, you're all over, and sometimes you don't think about yourself. You are the last one, and she came at my third trimester, took care of me, shared her sparkly shoes with me, made me laugh when I wanted to cry. You know, I saw that picture in the beginning, and honestly, it brings tears almost to my eyes because you can't control your emotions when you're pregnant. You're just all over, and Dr. Pauli has been so sweet and just wrapped me in her arms.
I love this relationship you guys have. You can just feel the warmth of it. But tell us, how did you become a patient?
It was my third trimester, and I wish I met her earlier on, but because she's just so bright and shiny, and she just is a wealth of knowledge and information. But we found out Riley around 18 weeks, which thank God for the ultrasounds and the ultrasound techs, but we found out about 18 weeks that she has a little heart problem, or a few, and I was referred by my pediatric cardiologist to go to Dr. Pauli, and she kind of picked up my care like it was very normal, and she walked me through every step of the way to get me to delivery.
So how did you manage Kourtney's case?
Kourtney came to me as a consult and was automatically going to be enrolled in our perinatal program because she had a baby with a heart defect. And luckily, again, I'm co-director, so it's something I'm very familiar with. So mostly, I mean, Kourtney was easy to take care of. Some of my patients are very complicated. She herself was a very easy and a very healthy mom. And so I did her prenatal care. We had prenatal visits, we measured her belly, we did ultrasounds, we did a little bit of extra testing on Riley because she had some extra fluid there at the end. But mostly I introduced her to the perinatal program and helped with my coordinators to get her plugged in with all of the people that she needed to meet, such as the NICU and the pediatric CT surgeon. And then as we got towards the end of the pregnancy, we planned her delivery and picked a day when everybody could be there and make sure that everybody was ready for when Riley came.
And when she did come, delivery kind of led into a stay at the NICU, and then Riley had to have heart surgery. Can you tell us about that experience?
Thankfully, I had a tremendous group of support between my family, my husband, my mom, my dad. I have lots of brothers and sisters-in-laws. But going into it, you're always nervous. I've had a toddler, and that was a scary experience, our first one. But once we were transferred, I mean, Penn State Hershey, it was amazing. I was set up with a coordinator, Dr. Pauli, and all of our doctors just flowed together. They were all in communication. There's a Penn State portal. I could check my appointments. I could check the times of everything. I could check what they've done to Riley. And then delivery, walked into the hospital. You know, they took care of me. I delivered on 11/7, and she was born. The NICU took her right away. They hooked her up to oxygen, got her on breathing, and they took her upstairs. They wheeled me upstairs for every feeding, and we went to surgery. Surgery was flawless with Dr. Clark, and after that we went to the PICU and then home to heal. So honestly, it was the best experience in a worst case scenario.
I love that. That was a perfect description, because we were talking about the comprehensive approach of this program, and you were just able to speak to all of that. So thank you so much for sharing your story.
Thank you. I appreciate it. Yeah.